So our next speaker is Tom Crabtree from United Kingdom. We'll speak about hemoglobin A1C and sensor glucose level changes with hybrid closed loop therapy in the real world, results from the ABCD audit of the NHS England closed loop pilot.
Thank you for the introduction. So yeah, I'm here today to present our latest follow-up data from the NHS England pilot, which some of you will be aware of, and the ABCD audit of those systems in the real world. These are our disclosures. So I'm sure everybody is well aware, but living with type 1 diabetes is like a juggling act, and we know that there's hundreds of different things that can affect blood glucose levels at any time, and that it often feels like you're trying to juggle a load of different balls in the air. We also know that in the UK we're not doing as well as we could be, and when we look at some data from the National Diabetes Audit for type 1 diabetes, we can see that we're only getting about a quarter of individuals down to a HbA1c of 53 or less, and we're getting about 40% down to a HbA1c of less than 58. So there's definitely room for us to be doing better in that regard. But we are now in an era where we have an opportunity to address both of those things, hopefully at the same time, where we can improve both glucose outcomes for individuals living with diabetes, but also help reduce some of that burden of day-to-day diabetes management, and that is obviously hybrid closed-loop therapy. There's lots of randomized control trial evidence out there now to support the use of various different systems. They're all demonstrating reductions in HbA1c, improvements in quality of life, and improvements in time in range. But lots of these come with the caveat that they're done in individuals who are already at or close to target to start with, and perhaps aren't representing the people that we're seeing in clinic who we're putting onto these systems. There is a trial that did look at people with above target HbA1c levels, but this was taking people from MDI to pump, so it's slightly different, but I'm sharing this for comparison to some of the data I'll be showing, and they had a 1.4% difference between the control arm and the hybrid closed loop arm, so it's a number to bear in mind for future. We're also now in the era of meta-analysis because you've had lots of randomized control trial data, and this has been done recently and again showed reductions in HbA1c and improvements in time in range, but again with the caveat that that's usually trials in individuals who are at or close to target to begin with. So randomized controlled trial data is great, and it's necessary for us to be able to say that new therapies are safe and that they're effective for use. But as has already been alluded to by previous speakers, it doesn't really give you the full picture. We know that in the real world we see patients less frequently. We know in the real world that people are often going on to these systems with higher HbA1cs, or they were individuals who might have been excluded from clinical trials. And I compare this a little bit to studying lions. So if you want to learn a little bit about lions, then you can study them in a zoo environment, which is very controlled. But if you want to know how a lion behaves in the wild, then we're going to have to go on safari, and that's where real data comes in. And we've obviously had lots of real-world data shared already, and there's been updated real-world data throughout the conference. But lots of these are limited to being views of single systems or their cross-sectional data reporting. And what we really wanted to understand is if we could take anyone onto any available hybrid closed-loop system, what improvements are we going to see? And so in the summer of 2021, which feels like a long time ago now, NHS England provided funding to centres across the country to put individuals onto hybrid closed loop to allow the collection of some real world data to support the use of these systems and the further rollout. So in the NHS England pilot for adults, these were individuals who were already on insulin pump therapy, already using a Freestyle Libre 2 sensor, and with a HbA1c above 69, so above target. This is data from 31 adult centres, and the funding was for 12 months access, but actually that funding was extended, so the follow-up for this is actually 1.4 years, because this is the latest update to the data. Alongside the pilot scheme, we collected data through the ABCD audit program, which is lots of programs that are active at the moment, looking at newer therapies and technologies in diabetes. And for this, we capture routine clinical data and ask clinicians to put this data into an online audit platform, which is secure. And our hope is that this will be one of the largest independent multi-system registries for closed-loop therapy moving forwards. We've already published our 6-month follow-up data towards the, I think it was in the summer of last year, and this was published in Diabetes Care, and this is the abstract for that. We got reductions in HbA1c of 1.7% in these individuals with above target HbA1c. We also had reductions in diabetes distress, improvements in time in range, and more people meeting those recognised glucose targets that talked about from the consensus. So for this, we asked individuals to put data into this secure online tool, and the data collection is still ongoing, so we are asking centres to continue to update data. So at some point, hopefully we'll be back with 2 years' worth of data, and we can see that those glucose improvements are going to continue. But for this, we just took anyone who'd had follow-up beyond 9 months, which was essentially the window for the first report, which was published in Diabetes Care. It's worth noting that for this, we weren't doing anything beyond routine clinical care, so the follow-up periods were just as per clinical need. So we do have a fair amount of missing data, so we're just looking at people who had available paired data for this analysis. For the initial 6 months, we had 570 individuals who were included, and that dropped down to 520 with people stopping the use of the systems. But for this data that I'm presenting today, we had 214 individuals with an average follow-up time of 1.4 years. The baseline characteristics are on screen at the moment. It's worth noting that there were significantly more female pump users, which I think is fairly standard across the board. A fairly older population, so 41 years old, so not really going too much towards that young adult age, but with a long duration of diabetes as well, so 21.2 years average diabetes duration. Which systems were being used? There's a pigeon in the room. Which systems are being used? Well, at the time, the available systems in the UK were predominantly the Medtronic and Tandem Control IQ, and that's really represented in this data. And here are the HbA1c results. So I think the main thing is to note that at this sort of 12-month beyond follow-up period, we've got HbA1c reductions of 16.7 millimoles per mole, which is about 1.6%. And if we look back at 6 months with those who had paired data, that was 18.1 millimoles. So that change in HbA1c is persisting beyond that initial window, HbA1c reducing down from 78.2 to 62.4. We've also got our sensor outcomes from 12 months, so we saw increases in time in range, we saw decreases in time above range, we had no statistically significant decrease in level 1 hypoglycemia, but time below 3 millimoles per litre was statistically decreased at 12 months. And for all of those, there were no significant differences. So those are very similar to the outcomes at 6 months, maintained out to the latest follow-up. So I know sometimes with technology, it can feel like people get an initial improvement that starts to slip, maybe if the novelty wears off and patient agreement with the treatment sort of fades a little bit, but we're not really seeing that with this cohort. I'd also just like to point out that we've got 2 other e-posters that are available to view with outcomes from the trial. So one is looking at change in weight and total daily dose. And we did see slight increases in weight that occurred by 6 months. So that was a weight gain of 1.8 kilograms. But there's no additional weight gain by 12 months. So you get an initial weight gain, but then a plateau, and we had increases in total daily dose that correlated with that. But interestingly, there was no correlation with baseline HbA1c. So for whatever reason, that doesn't seem to be necessarily an effective, maybe individuals being under-insulinized to start with. We've also got a poster sharing our quality of life outcomes, which were positive across the board, and we have 95% of users saying that they would recommend these systems to other people living with diabetes, and that the use of hybrid closed-loop therapy improved their overall quality of life. So in conclusion, in the NHS England pilot, hybrid closed-loop therapy is associated with improvements in multiple metrics, including reductions in HbA1c, improved time in range, and reduced time above 13.9 millimoles per litre. This occurs by 6 months and is persistent to 12 months at the moment. Our aim is to do ongoing surveillance. We've got some work that we're going to try and do around retinopathy in these individuals. We're going to be looking at a few different aspects of that. And as many of you will be aware, we've just had a nice technology appraisal in the UK that's improving the access to closed loop in the UK, and we're hoping to capture some data from those individuals as well. I'd like to thank you all for listening, and happy to take any questions.
Anyone? We have time for one question. No, thank you. You can take a breathe now. Thank you.